Hello and welcome to the Allogeneic Stem Cell Transplant Patient and Caregiver class at UC San Diego. If you or the patient aren't already familiar with UCSD's Moores Cancer Center, you definitely will be. Inside we have our outpatient lab, our infusion center, we have our own pharmacy, and then on the second floor in the Palm Tree Clinic is where our patients in BMT are seen for follow-up clinic appointments. We have an amazing team of bone marrow transplant practitioners here at UC San Diego. In addition to your primary BMT doctor, while in the hospital, you will always be rounded on and taken care of by one of our BMT physicians. In the outpatient setting, our patients get to know our nurse practitioners very well if they don't already. Each nurse practitioner is assigned a primary BMT physician with whom they work very closely with. Post-transplant, we do alternate visits with the physician and the nurse practitioner so they're seen weekly and that we can keep a very close eye on our patients. What are stem cells? Simply put, stem cells are the primitive or immature cells in the marrow that grow into all the blood cells in your body, including red blood cells, white blood cells, and platelets. These cells help make up the immune system. Red blood cells transport hemoglobin and oxygen to the tissues and organs of the body. White blood cells, in particular absolute neutrophil count or ANC, help fight and prevent infection. Platelets are the small blood cells that help our blood vessels stop bleeding when there has been an injury. Your stem cells are always dividing and changing into these different types of blood cells to replace older blood cells. Stem cells also divide to make newer stem cells. An allogeneic stem cell transplant is when a patient receives stem cells from someone else, either a related or unrelated donor, to establish a new immune system. The purpose of allogeneic stem cell transplant is to give a new immune system by giving high doses of chemotherapy and sometimes total body irradiation, TBI, disease-specific, in an effort to eradicate or lower the immune system. Donor stem cells are then infused through the PICC line. Stem cells mature and produce a new immune system. The entire process, including recovery, can take about 12 to 18 months. As mentioned before, donors can be either related or unrelated. Related donors are either siblings, which have the potential to be a 10 out of 10 match, or haploidentical donors, which could be siblings, parents, or children. Matched unrelated donors are identified through the National Marrow Donor Program and MDP through Be the Match, as well as cord blood donors. Our patients will work very closely with their physician's nurse transplant coordinator during every phase leading up to transplant. From the left, we have our donor searcher, Stephanie Brizuela. Then we have our BMT transplant coordinators, Jessica Malley, Genevieve Wood, Lindsay Springhetti, Cassie Fiore, and Marty Terry. And then we have our CAR-T coordinators, Mike Hurley and Bailey Pisecki. Preparing for transplant. Once the decision is made by the BMT physician to proceed to transplant, the patient will meet the nurse transplant coordinator. We will then begin the workup phase to ensure the patient's organs and social world are safe for transplant. Pre-transplant workup consists of labs, chest x-ray, EKG and an echo, pulmonary function test, depending on the disease, either a bone marrow biopsy or some imaging, 24-hour urine collection to evaluate kidney function. You will meet with one of our social workers for an in-depth psychosocial assessment with the caregiver present. We will ensure that there is caregiver support, housing requirements. We, of course, will have to obtain insurance authorization and ask that all patients and caregivers attend this class. Every patient will need to agree and sign a substance use contract and will also be randomly screened for drugs and alcohol throughout the journey. The contract will state that the patient agrees to abstain from smoking or vaping any substance, abstain from any illegal drug use, stop oral consumption of products containing marijuana or THC at least 30 days prior to transplant and through 100 days post stem cell transplant, or until otherwise cleared by the BMT physician, whichever is later, and to abstain from alcohol use prior to stem cell transplant for a period of time determined by the BMT team, depending on alcohol history, and through the first 6 months after stem cell transplant, or again until otherwise cleared by the BMT physician, whichever is later. Failure to adhere to these terms may be detrimental to the health of our patients and can make a patient ineligible for an allogeneic stem cell transplant. Caregiver expectations. Patient and caregiver must live locally for a minimum of 3 months in an apartment, single-family home or motorhome with a dedicated private unshared kitchen. We do require a 24/7 caregiver for a minimum of 3 months, but with an understanding that it can be up to 6 months, patient-specific. The caregiver manages medications initially, coordinates care between patient and staff, most importantly, alerts the team of any acute changes. The caregiver will accompany patients to all the initial appointments, assist with activities, transportation support, and food. Proceeding to transplant. We will set up in-depth teaching with the BMT transplant coordinator where we want both the patient and caregiver present if possible. We will be giving the most up-to-date tentative calendar at this appointment. Consenting appointment with the BMT physician, placement of a central line, the PICC line for the patient, preparing the donor, which includes evaluation and collection of the donor stem cells, and then admission to hospital for the allogeneic stem cell transplant. It is required that all of our patients receive a peripherally inserted central catheter, also known as a PICC line. Placement of the catheter is typically done in interventional radiology at Thornton Pavilion or over at Hillcrest. It will be very important to keep the catheter clean, dry, and intact. The infusion center will care for the catheter while outpatient, and the nurses in the hospital will care for the catheter while inpatient. It is going to be very important to monitor temperature, look at the area daily to monitor for infection. We will give you more information and specific instructions prior to transplant as we get closer. All of our patients will be admitted to and taken care of at the UC San Diego Jacobs Medical Center on the 6th floor, which is the blood and marrow transplant unit. Hospitalization. Some patients are admitted to the hospital for the conditioning chemotherapies, while others will receive conditioning chemotherapy outpatient in the infusion center and then be admitted the following day. All patients will remain in the hospital until the transplant team feels it's safe for the patient to be discharged home, usually about 3 to 4 weeks after receiving the stem cells. All of our patients will be staying on the 6th floor, which is the BMT unit over at Jacobs. Patients are allowed and encouraged to leave the room wearing a mask to walk around the 6th floor for exercise. However, patients are not allowed to leave the 6th floor unless they are being escorted to have a test performed, and a mask is always required to be worn. While on the 6th floor, bed alarms are utilized based on fall risk assessment done at every shift. Patients are attached to their IV pole until close to discharge. Patients will order food from the room service attendant for breakfast, lunch, dinner, and snacks between the hours of 6:30 a.m. and 7:30 p.m. Labs are drawn very early in the morning between 4 a.m. and 5 a.m. Vital signs are done every 4 hours and daily weights are done every morning. We do have a strict mouth care regimen about 4 to 5 times a day, morning, after meals, and bedtime. Patients will shower daily with a special soap provided, and all urine and stool is to be collected and should not be discarded by the patient. We do take fall prevention very seriously on our unit as our patients are at increased risk and will be evaluated for this on a daily basis. Injuries from falls can be detrimental, and if our patient's platelet count is low, then they are at even greater risk for bleeding and injury. The nurses, as well as PT/OT, will be doing a bunch of interventions to lower this risk, but it is very important that the patient does play an active role in preventing falls as well. This includes asking staff for assistance when walking, wearing non-skid socks or shoes, use a shower chair when they're in the shower, and participate in physical therapy exercises to stay strong. Outside food while in the hospital. Pre-packaged, single-serving food items, snack size, are allowed from home. Food cooked at home and brought to the hospital must follow food guidelines located in the back of the binder. Home-cooked food must be labeled with the patient's name and given to the nurse so it can be refrigerated for up to 48 hours. Food will be discarded after 48 hours if not eaten by the patient, and containers are typically not returned, so we recommend to use disposable containers. And if packaged food is not open, it will still be discarded on the labeled expiration date. No food from restaurants can be brought in for the patient. While on the unit, basic toiletries are provided as well as non-skid socks. If you want to bring slippers from home, they need to be non-skid and closed-toed. Please no flip-flops. Patients can wear their own comfortable clothing, but it needs to be laundered frequently by the caregiver. The preparative regimens consist of conditioning chemotherapy and/or total body radiation, TBI, and are essential to prepare the recipient's bone marrow to accept new stem cells. This can be given either outpatient or inpatient. These high-dose chemotherapy regimens range in intensity and can be given once or twice daily and typically over 1 to 6 days. The type of chemotherapy and specific regimen the patient receives is decided by the patient's BMT physician and team to provide the most effective treatment for the patient's specific disease, while also considering many other factors like disease status, donor match, and comorbidities. The acute side effects experienced by the patient vary from person to person and is directly related to the conditioning regimen and intensity received. However, there are definitely the most common side effects that are shared by all. Fever and infection caused by immunosuppression, which we definitely try to avoid, GI symptoms like diarrhea or even constipation, nausea, vomiting, loss of appetite, alopecia or hair loss, mouth sores caused by mucositis, which can actually affect the whole GI tract, neutropenia, or more accurately, pancytopenia, the lowering of all of the blood cells, which creates the need for transfusions of red blood cells and platelets. Donor stem cells will be given on day 0, aka the recipient's new birthday. This is typically around 36 to 48 hours after the patient completes the conditioning therapy. Donor stem cells may be freshly collected or cryopreserved, essentially frozen. If the donor cells are frozen, they will be brought up in a warm water bath and thawed in the patient's room. Stem cells are infused to the bloodstream, same as a blood transfusion, and the amount of time it takes depends on how many bags there are. Each stem cell bag takes about 15 minutes to infuse. In the next few days and weeks, the transplanted stem cells move to the marrow space in the patient's bones. There, they will slowly begin to mature and produce new cells. Recovery and engraftment. Engraftment is when the patient or recipient's body accepts the transplanted stem cells and have produced new blood cells in which the patient starts to recover white blood cells, red blood cells, and platelets. This typically takes about 2 to 4 weeks. During this time period, we support the patient with IV fluids, medications, antibiotics, and blood products will be given as needed until the patient has recovered. It is imperative if the patient has chills or does not feel well to let their nurse know immediately. Sometimes a patient may need to be moved to a different unit for a higher level of care, and once appropriate, they will be moved back to the bone marrow transplant unit. Preparing for discharge. Patients will be discharged once they have engrafted. This means their white blood count has recovered at a minimum of greater than 500 closer to 1,000. Hemoglobin is greater than 8 and platelets greater than 20. No fevers for 48 hours. The patient's able to eat and drink reasonably well and take all their medications by mouth. Post-transplant patients will have multiple medications going home. All discharge medications will be delivered to the patient's room prior to discharge unless otherwise specified. All medications will be reviewed prior to the patient leaving the hospital with the primary caregiver at bedside. It is essential for the patients and caregivers to have a complete understanding of medications prior to discharge. The patient will also not be allowed to drive on their own for at least 3 months, and this can be cleared by the patient's specific BMT physician. Preparing to go home. We do ask a thorough deep cleaning of where the patient will be going home to or discharged to the week to 48 hours prior to discharge. This allows the dust to settle. Use mild bleach solution or cleaning wipes to sanitize bathrooms, and if possible, designate one bathroom for the patient to use. Patients should use paper towels instead of cloth hand towels in the bathrooms and kitchen. Change the filter to the ventilation systems if possible, and we do ask that the patients not be allowed to clean. Patients should not do any gardening for up to 1 month post-transplant. Place plants outside the home if possible. Patients cannot change baby diapers, clean the cat box, or pick up dog excretions or any other animal excretions for 1 year post-transplant. We recommend that the cat box not be in the room the patient uses and preferably in the garage. No construction in the home for 12 to 18 months post-transplant. Anyone who works in construction or landscaping must shower and change clothes prior to seeing the patient, visitors, or those living in the home. Nutrition and hydration. Our patients will be placed on a modified low microbial diet after transplant. The food guidelines are located in the back of the transplant binder. Food must be cooked thoroughly. Leftovers must be placed in the refrigerator immediately after cooking and eaten by the patient within 48 hours. No food or drink from the outside the home until cleared by the BMT physician. This is typically after the patient is off immunosuppressants. We do recommend that our patients stay hydrated and drink a minimum of 2 to 3 liters of water daily and no alcohol for at least 6 months post-transplant. Proper nutrition is very important in the recovery of our patients. Proper nutrition helps the body to maintain healthy cells and support repair. It helps maintain a sense of well-being and reduce risk of other illnesses. It helps maximize the impact of treatment. Poor nutrition can reduce quality of life and functional status, increase risk for other illnesses, and reduce our body's natural defenses. It can also limit our body's ability to repair itself. That being said, it is very common for our patients to have poor appetite upon discharge from transplant. Some tips that we recommend are to eat 6 to 8 small meals instead of eating 3 large meals, for the patient to eat when they feel the hungriest, and to use smaller plates. Keep favorite foods in the home and set a timer to go off every hour to an hour and a half. Create an eating routine. Eat protein first and separate eating and drinking, and keep meal times relaxing. We also recommend that the patient have snacks on hand, especially during those long days here in the infusion center. Nutritional supplements may be recommended and can be helpful in filling nutritional gaps and getting extra calories and protein in. Nausea, vomiting, and diarrhea can be common after transplant. The first thing the patient should do is inform the BMT team that this is happening, just so that we can rule out any transplant-related complications. Some helpful supportive measures are for the patient to have some simple carbohydrates like bread, rice, pasta, ginger ale or tea, limit fat, sugar, artificial sweeteners, and caffeine, to drink plenty of liquids, to add soluble fiber to the patient's diet, like bananas, potato, rice, applesauce. You can also use things like benefiber and metamucil. Greek yogurt is great. It has protein, contains probiotics, and is easy to swallow. For constipation, we recommend that the patient increase in soluble fiber, like bran, prunes, plum juice, potato with the skin, popcorn, drink plenty of fluids, and have regular activity. If gas is a problem, we recommend omitting carbonated drinks, gum, not using straws, no cruciferous vegetables, cucumbers, or dried beans, peas, and onions. And if appropriate, the patient's BMT physician may prescribe a bowel regimen, including stool softeners. Again, hydration is very important post-transplant. We want our patients to drink 8 to 12 cups of caffeine-free, non-alcoholic liquids a day. We recommend the patient bring a water bottle with them whenever they leave their home, and to even take sips of water even if they're not thirsty. To stagger liquids with meals to increase overall consumption of both liquids and solids. And if urine is darker than the normal pale straw color or has a strong odor, the patient most likely needs to drink more water, but should also let their BMT physician's case manager know just in case they may have a UTI. Fatigue can be a big hurdle post-transplant, and the patient may feel more tired than expected. It's important that the patient remembers that this weakness and fatigue is normal, and each week the patient should get more of their strength back. Some tools and tips that we recommend is that the patient exercise each day, that they prepare meals ahead of time and have some frozen meals on hand. The use of convenient foods that are ready to eat can be helpful, and have friends and relatives help. Fluids, again, dehydration can worsen fatigue. Protein, increase rest, so getting enough sleep at night, taking naps if needed, minimizing caffeine, and avoid skipping meals, even if the patient has no appetite. Food is fuel, so eat or drink something every 2 to 3 hours is important, and to make eating a priority. Food safety. The goal of our food guidelines is to reduce the patient's risk of foodborne illness. Good hand hygiene is imperative always, but especially when handling food. Keep hot foods hot and cold foods cold. Avoid raw meat and fish, aged and soft cheese, no raw or unpasteurized drinks, honey, or unroasted raw nuts. Avoid homemade fermented drinks. All fruits and vegetables should be washed very well, and it's important to stay updated on any recalls or alerts. Our post-transplant patients are recommended to follow this diet until they're off all their immunosuppressive therapy. Preventing infections. We recommend that our patients shower or bathe daily and use their own towel and toothbrush. Towels and linen should be washed in hot water. Good hand hygiene again, so washing hands frequently with soap and water. This includes everyone, patient, family, and friends. We recommend paper towels to dry hands. Washing hands after touching an animal, before and after meals, before preparing food, after using the toilet, and before taking medications. Again, reminder, the patient is to not change any diapers. If the patient is going to be around children who have recently received live vaccinations, please verify with the pediatrician or your BMT physician if this is okay, as they may be shedding some of the virus. We want our patients to be wearing a mask in public areas with other people, including our infusion center and BMT clinic, limiting contact with other people and avoiding large crowds. Patients should not go to public places. Avoid people with infections or colds. If a family member or caregiver is sick, avoid direct contact and do not sleep in the same bed. No swimming in oceans, pools, or hot tubs. And again, practice good hand washing. After discharge, post-transplant, the patient and caregiver's point of contact will now be the BMT physician's case manager. Outpatient recovery and follow-up. Typically 30 days after transplant, the patient's disease will be reevaluated. The patient will be coming to the infusion center for labs 3 times a week at minimum, once a week visits with either the BMT physician or advanced practice practitioner, comprehensive visits or survivorship visits with the BMT physician or advanced practice practitioner. This is typically done immediately post-transplant at the hospital discharge visit, then again at the 3-month, 6-month, and 1 year mark. If the patient is not seen here at UCSD, they will return to their primary oncologist, and then we do start revaccinations at 6 months post-transplant. Infusion center. Patients will be seen in the infusion center 3 times a week and as needed, and may require early morning appointments. We do ask that our patients wait for all the lab results before leaving, just in case they may need to stay for some infusions. It is recommended to pack a lunch or snacks for the infusion center visits, as sometimes they can be long. Graft versus host disease, GVHD, is an immune response by the new immune system, the graft from the donor, against the host, the patient. It's the most common complication of allogeneic stem cell transplant, seen in 50 to 80% of patients. The symptoms seen in the acute within the first 100 days typically differ from the chronic after 100 days. Acute graft versus host disease is primarily seen in the skin, the GI tract, and the liver. GVHD of the skin can present as a faint or bright red rash, skin discoloration, tiny red bumps or blisters. There could be redness to the palms of the hands or soles of the feet. It's very important for the patient and caregivers to inspect the skin daily and let the team know if they see anything concerning. Skin GVHD can be diagnosed by doing a skin biopsy and can be treated with topical creams or, if needed, oral steroids. GVHD of the gut or GI tract can present with diarrhea, watery stools, increase in volume, cramping, nausea, or vomiting. If increasing diarrhea, it is very important that the patient or caregiver call and let the BMT team know immediately. Keep a record of the amount, frequency, and description, all the details. There could be loss of appetite and weight loss. We will diagnose GVHD of the gut with endoscopy or colonoscopy, and will most likely treat with oral steroids. If there is severe GVHD of the gut, we may have to hospitalize and give IV steroids. Steroids are a very effective treatment for GVHD. However, steroids do come with its own side effects like insomnia, increased appetite, irritability and mood swings, muscle weakness or muscle wasting, and steroid-induced diabetes. Graft versus host disease of the liver. We tend to see an increase in the liver function tests, LFTs, and these are done with the lab draws 3 times a week. It can also present itself with right upper abdominal tenderness, jaundice, which is the yellowing of skin or eyes, and fatigue. We diagnose GVHD with a liver biopsy, and it can be treated with either steroids or an immunosuppressive drugs. GVHD prevention. All patients post-transplant will initially be placed on immunosuppressant therapy. The exact medication or medications will be chosen by the BMT physician. Some examples of these medications are tacrolimus, sirolimus, cyclosporin, Cellcept or mycophenolate, methotrexate, and abatacept. Tacrolimus or Tacro is the most common used. We draw tacrolimus levels at every lab visit. We instruct the patient to not take their morning tacrolimus dose until labs are drawn. The patient can bring their tacrolimus to the infusion center and take it after labs. The patient and caregiver will be instructed on any dosage changes, and this can happen multiple times a week. Signs and symptoms of when to call. Definitely a fever. For us, a temperature of 100.5 or greater is a fever. We want our patients' temperatures taken every morning and evening. And if they're not feeling too well or feeling flushed or chilled, definitely take the temperature. If our patients are unable to take medications or keep medications down, any GI issues, nausea, vomiting, diarrhea, abdominal pain, skin changes, rash, bruising, petechiae, which are red like blood blisters, sores or abscesses, bleeding, nosebleeds, gums, hemorrhoids, black tarry stools, vaginal bleeding, blood-tinged urine, lung changes like shortness of breath, a new cough or wheezing, discomfort with deep breaths, Anything that you or the caregiver is uncomfortable with, it does not hurt to call and ask. Who to call? Prior to transplant, the primary contact will be the BMT transplant coordinator. After discharge from transplant, the primary contact will be the BMT case manager and the BMT advanced practice practitioner. Work hours are Monday through Friday, 8 a.m. to 4:30 p.m. If concerns arise after hours, on holidays, or weekends, you call the BMT physician on call. 858-657-7000. This is UCSD's operator. You ask for them to page the BMT physician on call. Typically, they will have you hold for the physician or the physician will call you back.
These are our bone marrow transplant social workers. From the left is Lauren Schaefer, Monica Lingle, Jennifer Shackleton, and Heather Elliott Pham. If you haven't already met with a social worker as part of your workup process, then you will meet with someone soon. Generally, we are assigned according to doctors and nurse coordinators, but we also work as a team and will cover for one another, so you may meet more than one of us on occasion. We look forward to spending time with you and helping you with navigating the transplant process. By now you have received a lot of information in this presentation and probably in other times of teaching. And I'd like you to take a few minutes to just notice how you're feeling now. It's really common for people to have a range of emotions and to feel different things at different times, and sometimes a mix of emotions at the same time. It's common for people to feel a little scared or a little overwhelmed, or to feel more confident and comfortable having more information. Some people feel ready to go to just get it done with, and some people feel a little nervous about having the transplant come up. The reason that we give you all of this information, however, is not to frighten you or overwhelm you, but because knowledge is power, and we want you to know what things are common, what things can happen pretty commonly, what things we are concerned about, so you know exactly what you're looking out for with your loved one, and you'll be able to catch things early. You are the expert on your loved one. It's very important for you to remember that. We are the experts on transplant, but you are the experts on your loved one. So you will catch things and notice things much faster than we will, and we want you to have confidence in your knowledge and expertise on your loved one. You're going to notice if they look pale to you, or if something doesn't seem right, or if their personality seems off, or they're suddenly really cranky, or they stop telling jokes and they're a jokester. You will notice these subtle things, and you're going to let us know because you'll notice them a lot faster than we will, and that's really helpful to us to know all of those different things. Communication is our number one thing. We are always here to communicate. We expect you're going to need to have information repeated. We expect you're going to ask some of the same questions over and over again. And it's our job to answer those questions as many times as you need us to until you feel really comfortable and confident with the information. So please don't hesitate to ask questions, to ask us to repeat things, even if we just explained it to you 5 minutes ago or yesterday or last week. We want to be here for you, and we want to explain whatever you need us to. It's very common that people can have some fears about being a caregiver and worry about being perfect. But I'm here to tell you that nobody's perfect, and we don't expect you to be perfect. We just expect you to do the best that you can and to communicate with us. Things, even under the best of circumstances, like in the hospital, can happen. People can get infections, people can get fevers, and it will happen, and we will just deal with everything as we come. We'll take it one by one, step by step, and if there are any issues that come about, then we deal with them and pivot our caregiving and change to whatever we need it to be. It's very important as a caregiver that you make sure that you have time to balance both the needs of the patient care needs along with your needs. We are all very, very good at helping others, but we are not always very good at helping ourselves. And as a caregiver, it's going to be essential that you make sure that you make time for breaks, that you allow other people to come on in and give you some respite care, some time to take for yourself, whether it's going for a walk, meeting a friend for a coffee, or going to your own doctor's appointment. As a caregiver, if you don't take care of yourself, you won't be able to take care of your loved one for very long. And as much as you worry about your loved one, they worry about all of you as well. So again, it's really important to make sure that you do build in some times for you to take care of yourself as well. And to remember that, as I said before, we are partnering with you as a caregiver to take the best care of your loved one. We are the experts on transplant, but you are the expert on your loved one, and together we make a team. We know transplant, you know your loved one, and please call us anytime, truly, truly 24/7. There is always someone here on call. In building your team of caregivers and support and help, it's important for you to consider, what does support look like to you? Many people have ideas about what can be supportive, but that may not be helpful to you or be what is your primary support concern. So looking at things or thinking of things and making lists such as practical support like grocery shopping, pet sitting, doing yard work, maybe carpooling your child to school, taking out the trash, things like that, can be really, really helpful. For some people, emotional support is going to be really important. Having someone that's a good listener, allowing me to talk about my illness if I'm the patient, or allowing as the caregiver for me to talk about the caregiving, or not talk about it. Maybe you want to be distracted with other things. Sometimes our friends and family members are afraid to share some of their life events that are going on because they may feel like it pales in comparison to what you're going through. But you still want to hear and still want to know about those things. So letting them know that if you do want to hear about those things, that's really important. It helps to still feel connected with everybody in your family and feel connected with the outside world. For some people, support can look like spiritual support. We do say you can't go to church or temple for a period of time after transplant, so being able to have someone to pray with you, or being able to be connected with online or social media spiritual support services can be really, really important if that is a big part of your life. So making sure that you really get to kind of figure out what support looks like to you and how that's going to best work. Sometimes, or most often I will say, people think of support, or one of the best things they can do is to bring you meals and create meal trains. And obviously with transplant, we tell you no meal trains. So that's why it's really important to kind of come up with ideas of things that is going to be helpful to you. People want to help and they want to show that they care and they love you, but they need knowing what will help you. Otherwise, they will come up with ideas of their own that may be not helpful or more distressing to you. So if you don't say anything, they may not even know that you need help. Usually people want to be able to do things and will be happy to pick from a list of different things that you can provide them. Allowing people the opportunity to help you is a tremendous gift to both you and to them. For many, it may not be a big deal to help do some of the tasks or activities. Maybe they have certain days of the week off and it's easy for them to provide transportation or to do a Costco run or a Target run or something like that for you. But for you, that may be a huge help because you're not able to get out to those places very easily, or maybe you don't like doing those kinds of things. So imploring people to be able to do the things that you find stressful or are difficult to get to is really important. And I would encourage you to kind of talk together with you and the patient and talk about what things that are things that you feel comfortable letting go of and letting other people help out with. These three website organizations are really, really helpful and provide a service that can be tremendous in helping you with coordinating what your needs are. They all offer the same type of a program where it's a private online platform where you can invite any of the people that are important to you and that are a part of your circle. And they can help with coordinating volunteer activities that you want help with. So you can make a list of the different things that you need help with, whether, like I said, it's taking out the trash or going to the grocery store or taking your dog for a walk or coming on over. Maybe you have a yoga class on Tuesdays and you want to be able to do it uninterrupted. So having someone come on over and hang out with your loved one while you get to do that. All those things are really helpful to be able to kind of list out if there's certain days that you need time off for, you can list those as well. And people can come on the website, they can sign in and sign up for as many or as few tasks as they're able to do. So you don't have to feel like you are pressuring anyone into doing anything. If they're not able to do it, they don't have to sign up. If they're available and they want to sign up for a few or for many, then they're perfectly able to do that. And it makes it very, very easy because it's people that you know want to do it. The website will then also help send out to reminders to those people. They'll send emails reminding them you signed up to do X, Y, and Z on this date, and they'll remind them as it gets closer to. So it helps you to organize and keep those on track for you. It's also an area where you can post updates about how your loved one is doing and information that you may want to pass along, as well as a place where people can leave comments and offer words of support and encouragement. So it's a very private space. It only includes the people that you choose to invite. All three, like I said, are very, very similar. It doesn't matter which one you pick. I would just say pick the one that you find the easiest to use and that you like the layout the best. But these are really a tremendous way to kind of help you with getting things done and even seeing a big picture of a calendar. Especially if you have more than one primary caregiver. If you are having several caregivers and you're going to rotate times, this is where it gets really helpful to be able to sign up for the days or the weeks or the month that you're going to do. And then people can each sign up, and then that's where you will end up seeing where do you need to fill in with some other people to help volunteer, or where are you having some of the holes in the caregiving needs, and can help manage all of that. Currently, in the times of COVID, the health department helps to direct us in terms of visiting hours and who's allowed to visit and for how long. So currently at UC San Diego Health, here in the Jacobs Medical Center, BMT patients are allowed to have 2 visitors at a time at their bedside. You can have more than 2 visitors in a day, but only 2 are allowed to be at the bedside at a time. All visitors must be at least 12 years or older, and visitors must show proof of COVID-19 vaccinations or proof of a negative COVID-19 test within 72 hours of visiting a loved one. If you're going to come back several times a week and you do not have the vaccination, you will have to show a new negative test each time. If you do have the vaccination, you will also have to show your proof of vaccination every time you come to visit. Visiting hours currently are from 8 a.m. to 8 p.m., and so you are free to come and go. We do request at this point, because our patients are immunocompromised, we prefer, if you're going to come and visit in the day, to visit that day and stay as long as you'd like. But once you leave the hospital campus, please don't return again until the next day. It's okay to leave the room and go down to the cafeteria or go sit outside for a little bit and come back in. But if you're going to leave and go somewhere like to the store or to pick up your kids from school or go to the Costco, then we would prefer not to come right back to the hospital and risk exposure. Our visitor policies will change based on the state of the pandemic, and based on what the health department tells us that we can and cannot do. We are hoping that we will eventually return to our previous visiting hours prior to COVID, and that we are able to have people spend the night. But currently, spending the night is by exception only. For the most up-to-date visitor information, please visit our website, UCSD Visitors. Caregivers, your needs are important too. It is important to plan for breaks, to take care of your emotional health, and to make sure your own healthcare needs are being met. Like I said before, just as much as you worry about your loved one who's going through the transplant, your loved one worries about all of you and worries about you taxing yourselves too much. So it is really important to find moments to relax. Some of these are some ideas of ways to relax. It's certainly not an exhaustive list. There are more ways than just this. But even just taking a few minutes to do deep breathing or progressive muscle relaxation, visualization and guided imagery, mindfulness meditation or mindful activities, going for walks, which is a great thing to do also with your loved one as we want them to exercise, watching or listening to the ocean or being in nature, listening to music, meeting a friend for coffee, going to an exercise class, or doing something special like that is really, really important. Luckily, most people have smartphones available to them and are able to have apps that can help with some of these activities. You can use them for a few minutes or for much longer to help relax, de-stress, meditate, help with going to sleep, and much, much more. These are five or just a few of some of the apps that you can download. These are all highly regarded to be able to use them for times, whether it's just taking a minute for relaxation, for watching the ocean, listening to the sound of rain, or for some breathing exercises for 5 minutes or 10 minutes with meditation, can be guided imagery of walking through a forest or down by a stream, just to help people relax. So you can take as many or as few minutes if you have. If you just have 5 minutes in the car, you can take those 5 minutes and do some of these things. If you have an hour to do a little bit more meditation or deep breathing or things like that, you also can choose that. So they have many different types of activities, so you can find what really works for you. Different things will work for different people. And they even have different bedtime stories and things to help with people going to sleep and lulling them to sleep and keeping people in a deeper sleep for longer. So I do highly recommend them. Some of them are free. I know the Calm app is, you can do many things for free. If you'd like to do some more of the more advanced things, then they do have subscriptions for the year where you can purchase that as well. And they are highly recommended, like I said. If you would like a copy of this presentation, please contact our patient navigator, Sandra Summerall. Her phone number is 858-249-2649, and her email is ssummerall@health.ucsd.edu. That's ssummerall@health.ucsd.edu. There will be a nurse and a social worker live and available at the end of this presentation to talk with you about any questions or concerns that you may have, whether it's something specific to you or whether it's in general about transplant. So please feel free to ask your questions and to bring up any concerns you may have, because we are happy to discuss them. Thank you for your participation.